Trauma and repeated exposure to highly stressful events have profound effects on the brain, reshaping neural circuits in ways that are adaptive in the moment, but often maladaptive over time. When the brain experiences threat, the amygdala, which functions as the emotional and threat detection center, becomes highly activated. This heightened amygdala activity signals other regions of the brain to prioritize survival over reflective thinking, triggering rapid responses such as fight, flight, or freeze. In parallel, the prefrontal cortex, responsible for executive functions like planning, decision-making, and emotional regulation, may become downregulated during these periods, reducing the brain's capacity to assess situations calmly and strategically. The hippocampus, which encodes contextual and spatial information and plays a critical role in memory, can also be affected, leading to fragmented, intrusive, or poorly contextualized memories. Together, these neural changes increase vigilance, sensitivity to potential threats, and reactivity, which may persist long after the original trauma has ended. Repeated traumatic experiences strengthen these survival-oriented circuits through a process called experience-dependent plasticity. Neural pathways that are frequently activated become more efficient and dominant, while alternative pathways for reflective thinking, emotional regulation, and flexible problem-solving may weaken. Over time, this rewiring creates a brain that interprets the world as continuously threatening, even in safe environments, leading to chronic hyperarousal, anxiety, or emotional dysregulation. Physiological responses such as elevated heart rate, shallow breathing, and heightened cortisol levels often accompany these neural patterns, further reinforcing the brain's survival mode. This means that trauma does not only affect emotional and cognitive functioning, it also creates a sustained physiological state that makes recovery more challenging if left unaddressed. The impact of trauma extends beyond immediate responses to how information is processed and stored. Memories of traumatic events are often encoded in a highly fragmented or emotionally charged manner, with strong activation of the amygdala but weaker integration into hippocampal networks. This results in vivid flashbacks, intrusive thoughts, or heightened reactivity to triggers that may be only tangentially related to the original event. Because these memories are poorly contextualized, the brain treats even minor reminders as urgent threats, reinforcing hypervigilance and defensive behaviors. Over time, these reinforced circuits make it more difficult for individuals to regulate emotions, engage in adaptive decision-making, or experience a consistent sense of safety. Trauma also affects motivation and reward processing. Chronic stress can dampen dopaminergic signaling in pathways related to reward and goal-directed behavior, reducing the ability to experience pleasure or pursue long-term goals. This combination of heightened threat sensitivity and reduced reward responsiveness contributes to patterns of avoidance, withdrawal, or learned helplessness. Behavioral tendencies that once were adaptive in a threatening environment may become restrictive and maladaptive in day-to-day life, limiting engagement with social, professional, or recreational opportunities. Recognizing that trauma reshapes neural circuits highlights the importance of interventions that can recalibrate the brain. Understanding these mechanisms explains why therapy, physiological regulation, and supportive environments are not just emotional or psychological tools. They are biological interventions that work directly on the neural architecture altered by trauma. By providing repeated, safe, and adaptive experiences, these approaches can weaken overactive threat pathways, strengthen regulatory circuits, and restore flexibility to emotional and cognitive processing. Therapy leverages the brain's inherent capacity for change, known as neuroplasticity, to treat trauma and other life challenges by creating structured experiences that reshape neural circuits. The brain is not fixed. It continuously adapts to experience by strengthening certain pathways while weakening others. This adaptability is central to therapeutic interventions, which aim to replace maladaptive patterns, such as hypervigilance, avoidance, or emotional dysregulation, with adaptive, flexible behaviors and thought patterns. Psychotherapeutic approaches, whether cognitive behavioral, exposure-based, or somatic, provide the conditions for targeted neural remodeling by guiding the brain through experiences that challenge existing circuits while reinforcing alternative, healthier responses. Cognitive behavioral strategies work by identifying and restructuring thought patterns that maintain maladaptive responses. Trauma often leads to distorted interpretations of threat, blame, or self-worth, which are reinforced by overactive amygdala circuits and underactive prefrontal regulation. Therapy provides a structured environment in which these thoughts can be recognized, challenged, and reframed. By repeatedly practicing new interpretations and adaptive responses, the brain strengthens prefrontal amygdala connectivity, allowing for improved emotional regulation and decision-making. This repeated focused engagement exploits experience-dependent plasticity. Neural pathways that are actively used become stronger, while unused or maladaptive circuits weaken over time. Exposure-based therapies harness neuroplasticity by safely confronting distressing memories or triggers. Avoidance is a common coping strategy that reinforces hyperactive threat circuits, keeping the brain locked in heightened vigilance. Through guided exposure, individuals gradually face previously avoided stimuli, allowing the brain to reclassify them as safe. This process diminishes amygdala overactivation and strengthens regulatory circuits in the prefrontal cortex, enabling a reduction in fear and anxiety responses. Over repeated sessions, these changes become durable, allowing for adaptive engagement with previously triggering situations. Somatic and body-based therapies focus on physiological states to facilitate neural recalibration. Trauma frequently leaves the autonomic nervous system in a chronically activated state, creating persistent tension, hyperarousal, or freeze responses. Interventions that integrate breathwork, movement, or mindfulness help shift the nervous system from sympathetic dominance to parasympathetic regulation. This modulation reduces cortisol and norepinephrine levels, stabilizing emotional responses and allowing the brain to engage in learning and adaptation more effectively. Somatic approaches also enhance interoceptive awareness, helping individuals detect and respond to physiological signals that often drive maladaptive behaviors unconsciously. Therapy also strengthens memory integration, addressing the fragmented or intrusive recollections characteristic of trauma. By guiding individuals to process emotional experiences, label feelings, and connect them to context, therapeutic interventions promote hippocampal prefrontal amygdala integration. This process allows traumatic memories to be encoded as coherent, contextualized experiences rather than overwhelming, unprocessed fragments that continue to drive maladaptive responses. Repeated practice reinforces these circuits, creating durable, adaptive memory networks that support emotional resilience. The combination of cognitive, emotional, and somatic strategies in therapy maximizes neuroplastic potential. By providing safe, repeated, and meaningful experiences, therapy reshapes maladaptive circuits, strengthens regulatory pathways, and restores flexibility to cognitive and emotional functioning. This demonstrates that therapy is not only a psychological intervention but also a biological one, harnessing the brain's natural capacity to reorganize itself in response to focused, guided experiences, promoting recovery and resilience over time. Regulating physiological states is a critical component of effective therapy for trauma and life challenges, as the body and brain are intimately connected in the processing of stress, emotion, and memory. Trauma often leaves the autonomic nervous system in a chronic state of hyperarousal, resulting in elevated heart rate, rapid shallow breathing, muscle tension, and increased cortisol and norepinephrine levels. These physiological patterns reinforce neural circuits associated with threat detection, hypervigilance, and emotional reactivity, making it difficult for individuals to process experiences calmly or respond adaptively to stressors. Interventions that directly target these physiological states through techniques such as controlled breathing, somatic awareness, grounding exercises, and movement can recalibrate autonomic balance, reduce hyperarousal, and improve emotional regulation, creating a foundation for deeper cognitive and emotional work in therapy. Breath regulation is one of the most accessible and effective tools for shifting autonomic states. Slow, rhythmic breathing engages the parasympathetic nervous system, reducing heart rate, lowering cortisol, and modulating neural activity in the amygdala and prefrontal cortex. By intentionally controlling respiration, individuals can downregulate stress responses, creating a state in which the brain is better able to engage in reflection, emotional processing, and learning. Over repeated practice, these changes reinforce pathways that support calm, adaptive responses to stress, gradually weakening circuits that perpetuate hypervigilance and anxiety. Somatic awareness and body-based techniques further enhance regulation by teaching individuals to recognize and respond to physiological signals associated with stress or trauma. Tension in muscles, shallow breathing, or subtle shifts in posture can act as triggers for heightened arousal, often outside of conscious awareness. By bringing attention to these signals, therapy helps individuals develop interoceptive skills, allowing them to intervene early and modulate their physiological state before maladaptive patterns escalate. This practice strengthens neural pathways connecting the body and brain, enhancing self-regulation and resilience. Movement and physical activity also play a significant role in regulating physiological states. Activities ranging from gentle yoga and stretching to more vigorous exercise increase cerebral blood flow, release endorphins, and stimulate growth factors like BDNF, which supports synaptic plasticity and neural adaptability. Exercise reduces stress hormones, modulates dopamine and serotonin signaling, and promotes a sense of agency and mastery, which is particularly important for individuals whose trauma has left them feeling powerless or dysregulated. By pairing movement with intentional focus on breathing and bodily sensations, therapy integrates cognitive, emotional, and physiological systems, creating a holistic pathway to regulation. Grounding techniques, such as focusing on the senses, feeling contact with the environment, or mentally scanning the body, help anchor attention in the present moment, counteracting the pull of traumatic memories or anxiety-driven projections. These interventions stabilize autonomic activity and enhance prefrontal control over limbic reactivity, improving decision-making and emotional resilience. By repeatedly practicing grounding and somatic regulation in safe contexts, the brain learns to shift from survival-oriented circuits toward adaptive states, strengthening neural networks associated with safety, reflection, and flexible response. By intentionally targeting physiological regulation, therapy not only reduces immediate stress responses, but also creates the neural and bodily conditions necessary for trauma processing, emotional integration, and behavioral adaptation. This approach demonstrates that healing is not solely a cognitive or emotional process. It is deeply embodied, requiring consistent engagement with the body and nervous system to support lasting neural and emotional processing is a central component of recovery from trauma and life challenges because emotions are deeply encoded in the brain's neural circuits and influence how experiences are stored, interpreted, and retrieved. Trauma often disrupts the brain's ability to process emotions effectively, leaving individuals with heightened reactivity, avoidance patterns, or difficulty labeling and integrating feelings. The amygdala, which signals threat and emotional salience, becomes hyperactive in trauma, while the prefrontal cortex, responsible for regulation and reflection, may be underactive. This imbalance makes it difficult to interpret emotional experiences accurately, leading to overreactions to minor stressors, persistent anxiety, or emotional numbness. Therapy provides a structured environment in which emotional experiences can be safely explored, labeled, and integrated, strengthening the neural connections between limbic structures and regulatory cortical regions. A core principle of emotional processing in therapy is creating safety and tolerable exposure to intense emotions. Avoidance of uncomfortable feelings is a common response to trauma, but it prevents the brain from integrating emotional information and resolving distressing experiences. Structured approaches such as guided recall, narrative therapy, or emotion-focused interventions encourage individuals to confront and experience emotions without being overwhelmed. By repeatedly engaging with emotions in a controlled context, the brain forms new connections that reduce amygdala hyperactivity and enhance prefrontal regulatory control. Over time, these strengthened circuits improve emotional resilience, allowing individuals to experience, tolerate, and respond adaptively to a wider range of emotional stimuli. Labeling emotions accurately is a critical mechanism in emotional processing. When individuals identify and articulate what they are feeling, the brain integrates these experiences into a coherent narrative rather than leaving them fragmented. This process enhances hippocampal prefrontal amygdala connectivity, promoting regulation, reflection, and memory integration. For example, distinguishing between fear, anger, or sadness helps the brain respond appropriately to specific situations rather than defaulting to generalized threat responses. Repeated practice of labeling and reflecting on emotions strengthens neural pathways that support awareness, self-regulation, and adaptive decision-making. Reframing and cognitive restructuring are additional tools that enhance emotional processing. Trauma often generates maladaptive interpretations of events, such as self-blame, overgeneralization, or catastrophizing. Therapy guides individuals to challenge these patterns and reframe experiences in ways that are realistic and constructive. By linking emotional responses to alternative perspectives and adaptive interpretations, the brain rewires circuits that previously reinforced fear, shame, or helplessness. This process not only reduces distress, but also supports adaptive behavioral responses, improved relationships, and a stronger sense of agency. Integration of emotional experiences with physiological regulation further enhances outcomes. Techniques that combine body awareness, breathing, and movement with emotional exploration allow the nervous system to shift from hyperarousal or freeze states toward regulation, creating conditions for deeper processing. Emotions that are fully experienced, regulated, and contextualized are more likely to be encoded as coherent, adaptive memories rather than fragmented or intrusive patterns. By systematically engaging with emotional experiences, labeling, reframing, and integrating them with bodily regulation, therapy strengthens the brain's capacity for emotional resilience, adaptive behavior, and cognitive flexibility. This process demonstrates that emotional processing is not just a psychological practice, but a biological mechanism, reshaping neural circuits to promote recovery, balance, and the ability to respond effectively to life's challenges. Psychological transformation. Social support and connection play a pivotal role in recovery from trauma and life challenges because the brain and body are inherently social systems. Humans are wired to respond to social cues, and safe, supportive relationships activate neurochemical pathways that reduce stress and enhance resilience. Trauma often disrupts trust and social engagement, leaving individuals feeling isolated, hypervigilant, or disconnected. By engaging in relationships characterized by safety, empathy, and attunement, individuals can activate oxytocin and serotonin systems, which counterbalance stress responses, promote feelings of safety, and facilitate emotional processing. These neurochemical effects directly influence neural circuits, reducing amygdala hyperactivity, strengthening prefrontal regulation, and supporting integration of traumatic memories into coherent narratives. Social support provides a safe context for practicing adaptive responses. In the presence of trusted individuals, the brain can shift from defensive hypervigilance toward engagement, allowing regulatory circuits to strengthen. Interactions such as sharing experiences, receiving validation, or participating in collaborative problem-solving provide repeated opportunities for the nervous system to experience safety and trust. Over time, these experiences weaken threat-dominant neural patterns and reinforce circuits associated with social learning, cooperation, and emotional resilience. This is why group therapy, peer support, or collaborative interventions often amplify recovery. They provide repeated, structured opportunities for the brain to experience safe, supportive social connection. Communication and attunement are central to social support. Trauma frequently impairs the ability to interpret social cues accurately or to respond adaptively, contributing to misunderstandings or withdrawal. Engaging in relationships that provide clear, consistent, and empathetic feedback trains the brain to recognize and respond to social signals more accurately. Mirror neuron systems, which allow individuals to simulate and understand others' emotional states, are reinforced through repeated social interaction, improving empathy, emotional intelligence, and relational flexibility. These strengthened networks not only support recovery from trauma, but also enhance long-term social functioning and the capacity to form healthy relationships. Social connection also supports emotional processing and regulation. Sharing experiences with trusted others allows for the articulation of feelings, which strengthens hippocampal prefrontal amygdala integration. This process enhances labeling, contextualization, and reframing of emotional experiences, reducing the intensity of distressing memories and promoting adaptive coping. Moreover, experiencing mutual support creates positive reinforcement through reward pathways, engaging dopamine circuits that increase motivation, encourage proactive behavior, and build confidence in managing challenges. Even brief social interactions can have meaningful neurobiological effects. Simple experiences of validation, listening, or empathic presence can modulate cortisol levels, reduce autonomic arousal, and signal safety to the brain. These effects are cumulative. Repeated experiences of connection progressively strengthen circuits for trust, social engagement, and emotional regulation, creating a foundation for resilience and adaptability in response to future stressors. By integrating social support into recovery processes, therapy leverages one of the brain's most powerful adaptive mechanisms. Relationships provide both neurochemical and experiential reinforcement that accelerates healing, strengthens regulatory pathways, and facilitates emotional and cognitive integration. This demonstrates that trauma recovery is not solely an individual cognitive or emotional process, but a profoundly social one, with the behavioral engagement is a critical mechanism in therapy for trauma and life challenges because it actively shapes neural circuits involved in motivation, reward, and adaptive functioning. Trauma often disrupts these circuits, leading to diminished motivation, avoidance behaviors, and learned helplessness. The dopaminergic system, which underlies reward processing and goal-directed behavior, may become underactive, reducing the brain's ability to anticipate or respond to positive outcomes. Structured behavioral interventions provide opportunities to reactivate these circuits by creating experiences of success, mastery, and incremental progress. By intentionally engaging in goal-directed activity, individuals stimulate dopamine pathways, which not only enhances motivation but also strengthens the neural network supporting adaptive behavior and learning. Incremental challenges are particularly effective because they balance difficulty with achievability. When tasks are too easy, they fail to engage the brain's reward and learning systems. Conversely, tasks that are too difficult can lead to frustration, avoidance, and reinforcement of maladaptive neural patterns. By designing behavioral interventions that are progressively challenging, the brain experiences repeated cycles of effort, success, and reward. Each successful engagement reinforces dopaminergic signaling, increasing the likelihood of continued effort and adaptive behavior. Over time, these reinforced pathways improve resilience, problem-solving, and the capacity to navigate complex or stressful situations. Behavioral activation also addresses avoidance patterns that often arise from trauma. Avoidance strengthens fear-based circuits by preventing the brain from encountering experiences that could recalibrate threat responses. By deliberately confronting situations in a graded and controlled manner, the brain learns that these experiences are manageable, reducing hypervigilance and maladaptive emotional responses. Each exposure, coupled with successful engagement, strengthens prefrontal amygdala regulation, allowing individuals to approach challenges with greater confidence and flexibility rather than reacting with anxiety or withdrawal. Reward and reinforcement are central to behavioral engagement. Positive outcomes, even small ones, trigger dopamine release, which signals the brain that the action or behavior is valuable and worth repeating. This neurochemical feedback not only motivates continued engagement, but also strengthens synaptic connections in circuits related to decision-making, planning, and adaptive responses. Activities that combine skill development, social interaction, and tangible achievement are particularly potent because they engage multiple systems simultaneously, enhancing learning, motivation, and emotional regulation. Goal-directed behavior also interacts with emotional and physiological regulation. Completing tasks, practicing new skills, or participating in structured routines provides a sense of mastery and agency, counteracting feelings of helplessness often associated with trauma. This sense of control activates prefrontal networks, reinforcing regulatory mechanisms that suppress overactive threat responses and promote flexible thinking. The integration of emotional, cognitive, and physiological engagement ensures that the brain learns to approach challenges proactively rather than reactively, gradually shifting from survival-based patterns to adaptive functioning. By systematically incorporating behavioral engagement into recovery, therapy creates repeated, structured experiences that recalibrate the brain's reward, motivation, and adaptive circuits. This process strengthens goal-directed behavior, reinforces resilience, and enhances the ability to respond flexibly to life challenges. Through deliberate practice and incremental achievement, the brain rewires itself, supporting recovery and long-term functional improvement, responding dynamically to safe, consistent, and attuned human connection. By consistently incorporating behavioral engagement into daily practice, individuals can transform the neural circuits disrupted by trauma into pathways that support motivation, resilience, and adaptive decision-making. Each successful experience reinforces the brain's reward and regulatory systems, gradually shifting patterns from avoidance and hypervigilance to confidence and agency. Over time, this deliberate activation of goal-directed behaviors not only strengthens cognitive and emotional functioning, but also enhances the ability to navigate complex life challenges with flexibility and purpose. This demonstrates that recovery is not a passive process. It is an active, experiential journey that reshapes the brain through intentional action and reinforced learning.